Welcome, everybody. Welcome to today's 5 ways to engage men in wellbeing at work. This was a particularly popular session. We had over 250 people register to attend this session. So welcome, and I'm so pleased that we're finally all here talking about men's health today. For those of you who don't know me, my name's Emily Pearson, and I'm the founder and CEO at the Wellbeing Lead Academy, and also the developer and founder of the Manbassador program as well. So I'm really excited to have you all here today. You can ask questions, you can put your hand up, and I can click a button to allow you to talk, but the easiest way to get involved is to ask questions in the Q&A box, and I will make sure that we get them answered. Don't worry about taking notes or anything. I will follow up with the slides for you so that you have it all. You'll have the ebook as well in a follow-up email, and all of the links to everything that I talk about throughout the session today. So I will make sure I follow up with all of that information for you to leave today with some actions so that we can start improving men's health together. So just want to start off just telling you a little bit about who I am. My name, as I said, is Emily Pearson, and I have worked in health and social care and workplace mental health and wellbeing for over 25 years now. I know I don't look that old, but honestly, I am. I've spent 15 years working in health and social care as a practitioner and educator in various different settings: children looked after care, criminal justice, drugs and alcohol, dual diagnosis, homelessness services. One of the things that I realised through working in those services was that the majority of service users were unfortunately young men, older men, and boys in looked after care. So I always had a feeling of supporting men when they're going through a difficult time in their lives was very important for us to do. 10 years ago, I was part of the team that developed and piloted the Minds Blue Light program, which was commissioned by the government. So again, a very male, masculinized, majority male sector where we were going in talking about how do we change the culture around mental health. It had a huge impact, and the legacy is still left behind today, and many organizations in the blue light services are still running with their blue light program and blue light champions. I'm the founder of the Wellbeing Lead Academy. We have been going for 8 years, working specifically in supporting our clients to develop and deliver impactful wellbeing strategies. I'm also the founder of the first and only accredited career pathway for workplace wellbeing leadership from a level 3 to a foundation degree level 5. I pioneered the first workplace men's health intervention called the Manbassador program, which is why we're here today. And I'm also the pioneer of the Human Sustainability Framework. Hopefully that just gives you a little bit of an insight what I've been doing over the past 25 years and why am I here talking to you today about the Manbassador program and how do we engage men in the workplace. Back in 2022, I had a little bit of a profound Starbucks moment where I was with somebody at the time who was delivering some men's health sessions, and a stranger walked over to us and said, "Are you this guy who I was with from this organization that he was with at the time?" And he said yes. And he said, "I just need to say thank you because a webinar, the education session that you delivered to our organization made me realize that I was ignoring symptoms." He then went to the GP, was diagnosed with late stages of prostate cancer. However, it was early enough for it to be removed. He had treatment and he was alive today. His wife was also there. She had a hand on her heart saying thank you. Obviously, I'm in tears by now, but that for me was really the moment, that spark. We needed more in the workplace if we truly wanted to save lives. And because I'd been working in workplace mental health for quite a while by then, around about 5 years, I also realised that a lot of the work we were doing around mental health and workplace wellbeing was often quite feminised. There was a lot of women in wellbeing leadership HR roles who were given the responsibility to raise awareness, tackle stigma, and improve health and wellbeing in the workplace. And unfortunately, what that meant was that many wellbeing strategies, and not through the fault of anyone other than, there just wasn't any knowledge around that, was that wellbeing strategies were often feeling unrelatable for men. They didn't feel as if they were developed for them, and therefore weren't really equitable for them. They didn't feel engaged. So back then, there were no targeted men's health interventions in the workplace. Manbassador was the first one of its kind, and that was despite the quite stark statistics that 1 in 5 working age men die prematurely from mostly 5 of the biggest preventable causes. And on average, men die around 6 years earlier than women do. And those 5 big preventable killers, mostly preventable killers, are heart disease, prostate cancer, lung cancer, bowel cancer, and suicide. Now, if you're thinking about your workplace wellbeing strategy at the moment, you may be thinking, actually, do we even do anything around that? Do we include these in our physical health strategy? Do we include men in our strategy? Will you maybe do stuff around suicide, mental health first aiders, mental health awareness day? But as you can see, when it comes to the statistics, suicide kills around about just under 6,000 men, about 5,500 men every year. Heart disease kills over almost 250,000. So in terms of numbers, you can actually see that heart disease is one of the biggest risks for your men in your workplace who are over the age of 50. So aging workforces, this is also for you because the risks do increase as people get older. Suicide is the biggest killer of men under the age of 50. But once they reach 50, we've got heart disease, prostate cancer, lung cancer, and bowel cancer that actually take centre stage. So I took it me upon myself to research, well, what was actually going on? What was so important about men's health that we needed to really recognise it as a risk in the workplace, and what could we do about it? And what the research told us that there were some very key challenges for men. First of all, their biology. They have a Y chromosome and an X chromosome, which means that if there is something wrong with their Y chromosome, they don't have a backup like women do. Women have 2 of the same X chromosomes, so therefore we have a backup. That often means that just chromosomal issues, the fact that you're a man, is going to put you at risk as some of these biggest killers. And we probably all know in the room that heart disease is particularly hereditary within men in a family. There are also age-related risks, as I've just alluded to there as well. But what we also found in the research, that socioeconomics was a big impacting factor as well. So these were generally what we would class as blue-collar workers, men who were living in low-income societies and communities. This put them at much higher risk of the 5 biggest killers. Coping strategies. Some men do have gender-related coping strategies. This is where we see higher rates of alcohol and drug use and behavioural addiction as coping strategies. One of the most stark statistics around this is that actually drugs and alcohol kill more men every year than suicide does. It just isn't reported in the same way. And that's because they don't include alcohol and drug deaths together as one substance, as substances. They separate them, which unfortunately that means that we don't realise that actually substances take more lives of men every single year than suicide does. There is a huge lack of health education for men, often because there's just less engagement opportunities in preventative health care. So if you think about being a woman, as soon as you've started your periods, you've got to have checks done. You're in the doctors for hormonal issues. We're back to the doctors when we're pregnant, and then HR and HRT. And there's so many opportunities for women women to be involved in healthcare from a very, very young age, whereas for men, that's completely missing. The first time a man will actually get a letter to attend the doctors is when they reach 40 years old and they're asked to go for their MOT check. So we also know that there is male-specific stigma. Men do often feel like seeking help is weak, and it makes evolutionary sense. If you are the man, the protector of the community, of your tribe, looking weak means that you look weak within your tribe. That's to the women around you and also to the men around you as well. So it's almost hardwired into the brains of men to feel this way. So this is what some of the research showed us. But one of the most stark things that I discovered was back in 2015 when I was working for Mind, I was asked to develop a program for the GPs in the Newcastle area because a piece of research had come out to show something really frightening. And what that was that suicide risks in men were being underestimated. This piece of research actually found that 82% of men who died by suicide had spoken to a primary healthcare worker, so it's your GPs, possibly A&E, within the 6 months of them taking their lives. This really absolutely smashed the myth that men don't talk and men don't ask for help. Actually, men were talking, they were asking for help, but the assessment process and the support just wasn't there. As you can imagine, this was the nail in the coffin for me. I was like, my gosh, we must do something about this. And that's where the Manbassador program came from. So the Manbassador program is a peer-to-peer men's health intervention for the workplace. What it does is it takes a gender-specific approach based on all of the research and the evidence to improve in men's physical and mental health. And what it does, it tackles the 5 biggest killers of working age men that we've just covered there. And it's designed specifically for prevention and early intervention, hoping to reach men way before they get to crisis. The way that we do it is that we harness the power of what's called male camaraderie, shoulder-to-shoulder conversations and activities. I discovered this very early on without actually realizing that it was a thing. When I used to work in the criminal justice system with young men, I always had a pack of cards in my back pocket when I was doing interventions with men. And these were young men, almost, even boys who were in the criminal justice secure environment, almost like a prison. I was an intervention worker there. And the only way we could really engage them was to play footy. Well, you can't really have great conversations about stuff while you're playing footy. So I used to carry a pack of cards around. Funny that, I always tend to have a pack of cards lying around. It must be one of my things. If anyone fancies a game of cards and a coffee, just let us know. I would always carry a pack of cards around, and my intervention sessions were playing cards. We would learn to play games together. There were some games that I was particularly good at. So this really took the focus away from the conversation. It was shoulder to shoulder. It created natural conversations, and it was based around an activity. So this is evidence-based. It helps to tackle stigma. It increases help-seeking behaviour, and that evidence comes from the Centre of Male Psychology and research by the Samaritans as well. And I'll tell you a little bit about how it actually does that in the case study soon. So this really does challenge that outdated narrative that men need more, that outdated narrative that men just need to talk more. What this really does is it victim blames. It tells men that the reason that you're dying is because you're not talking about it, when actually what we need to be doing is providing the right services, the right support, and engaging them in the right way. And when they are talking, making sure that we're assessing them properly within healthcare, and ultimately providing that support to keep them alive and keep them safe. The thing with the Manbassador program, why it is so successful, is it's owned and led by the men in your workplace themselves, which makes it super relevant, super impactful. It's blatantly for men, by men. It's called the Manbassador program. All the communications are male specific. The even down to the way we market our colourings, all very targeted targeted around engaging men. So this is how it works and why it works so well. This isn't just some training for people. We've actually developed a blueprint for the Manbassador program, but also for if you've got mental health first aid programs, champion programs, this blueprint is for any peer-to-peer service, which helps them to stay safe. It's safeguarded, it's collecting data, it's evidencing the impact. But the first thing we do is we work with you to find a Manbassador sponsor. This is usually somebody in the senior leadership team who is committed to making sure that this gets the visibility, it gets the resourcing of the programme, and they really become the face of men's health in the workplace. We work with you to find a Manbassador lead. This may be you, but the Manbassador lead oversees the blueprint implementation and the ongoing operations of the Manbassador programme. We implement the blueprint with you, which is the structured best practice framework, which includes everything from the recruitment process, safeguarding processes, data collection, supporting our Manbassadors going forward, and how do we make the programme visible and accessible to the organisation. Your Manbassadors, we go take them through a recruitment process. They are then trained on a 2-day level 3 certified men's health ambassador qualification. They become the role models. They become the active campaigners for men's health. The Manbassador programme also has its own campaign and education programme as well. It's called Where's Your Head At, Mate? And this is a mental health check-in tool that can be used as a campaign, one-to-one conversations. And it's also one of our webinar and face-to-face talks that we deliver to help men to better understand the 5 biggest killers, how to prevent them, and be ready to take action after the session. We also provide ongoing support. So every quarter, we have lead meetings with all the Manbassador leads, and we provide community events. We're always trying to engage our Manbassadors and our leads to help them to solve some of the challenges that they come across with their programme. We don't just leave you and wave goodbye. We're here to support you so that you can self-sustain your programme going forward. And then our Manbassador challenges. We run them twice a year during Men's Health Week in June and then November, and we partner with active teams to do that. I'm very excited. Hang around to the end when I tell you what the new Manbassador challenge is that we've just launched, because it's got something to do with the World Cup and physical health, and the impact is going to be amazing. Okay, these are just some of our partners for the Manbassador programme who we work with, who have Manbassadors in their workplaces and also who support us to deliver it. So day 1 of the accredited training is actually delivered by the award-winning Ryan Park, the men's coach, who's actually just published an Amazon bestseller book called How to Help Him. I've got this around somewhere as well. I think it's up on the shelves. He really does specialise in men's health, and we're very proud to have him as one of our delivery partners as well. So this is what men's health and well-being looks like in the workplace. It looks like pie making. It looks like football tournaments. It looks like boxing. It doesn't look like come and sit and have a cup of tea and talk about your feelings. It looks like guys walking around proudly with their Manbassador t-shirts on, being at campaigns, being at conferences in the organisation to really show that this is on the agenda, it's visible, and people are engaged. It also looks like engagement for everyone. Even though the Manbassador programme is targeted at men, and only men can be the Manbassadors, and that's for very, very clear reasons around relatability, psychological safety, and ensuring that the storytelling, which is a very big part of the Manbassador programme, sharing their relatable lived experiences, a part of that. Anybody can be part of the activities, the challenges, come along to the awareness events. Everything else is open to all. So let's get into the 5 ways. Now I've showed you a little bit about what we've been doing at Manbassador over the past couple of years. I then took all of this learning and developed 5 ways to engage men in wellbeing at work. Put it into an ebook, which I'll send over to you all afterwards, but wanted to share them all here with you today. We'll start off with number 5 and count down to number 1. So the first thing that we are doing here is evaluating your current initiatives. So think about your initiatives that you have already. They may not necessarily be targeting men. So how do we make them more relative to men? How do we make sure that we include them? So we can do some asking of questions, collect some data, but are they relevant, targeted and engaging for your male workers? If they're not, then we may need to review them and look at how we can do that. The other side of this is, what barriers are we creating for your male workforce to engage in them? You know, especially if you've got harder to reach male colleagues who are driving trucks Monday to Friday, away from home. How will we get engaging them in mental health and well-being? So think about the barriers and engaging your harder to reach groups. Does your current mental health and well-being strategy or activities, if you don't have a strategy yet, account for the health inequalities that many men experience? As I said, there's 6 years difference between when men die and women die due to a number of health inequalities that we need to tackle out in our community through NHS, through the government as well, but also in the workplace. Just to, off the top of my head, the construction industry has the highest level of suicide rates per any other industry. They are 91% male, might even be a little bit higher than that, 91% male. Lorry drivers, drivers who are driving all day are at higher risk of heart disease because they're sedentary. If they're working away from home, sleeping in the trucks, they have less opportunity to eat healthy food on a day-to-day basis. They're more isolated, they can't get physical exercise in. Work becomes a determinant for poor health and well-being, which is a big factor around men's health. Have you consulted with your male workers? Are you avoiding assumptions and actually asking them direct and specific questions about what their needs are? So reviewing barriers, how are we engaging the hardest to reach, and making sure that we're really looking to tackle some of the inequalities that men experience in the workplace. Number 4 is all about building a culture of trust. One of the things that we found out with our Manbassador research was that we asked men, if you were, have you ever spoke to anyone about a mental health problem? Or if you were, who would you speak to first? The top 3 answers was their partner would be the first person. Of course, we're usually the most trusting person in their lives. The next one was their friend. So they would speak to their friend before a family member, which was interesting. I think our friends are definitely our chosen family. And then it was their manager. So the top 4 people that male colleagues would speak to were people outside of work, but then the first person inside of work is their manager, not a mental health first aider. That was on the list. That was only 3% of who people would speak to. It's their manager. And this is because we've got to build a culture of trust. Again, working in male-dominated, majority male services for such a long time, this was again another thing that I realised. When I worked in the criminal justice system, in the secure environment, I was an intervention worker and custody officer in. We had one unit of 7 girls in there. They were all under the age of 20. And we had 6 units, all of young men under the age of 20. And one of the things that we found, or one of the things that I personally found, is that we build trust differently. Women are very, very good at being put together as strangers. Within 10 minutes, we will know husbands' names, kids' names, what was childbirth like, are you in menopause yet? And women are very good at sharing intimate details about themselves quickly. That's because women usually need to learn, can I trust this other woman with this information? And we also, it makes us feel good by sharing this information and building this relationship quite quickly. For guys, it happens a little bit of a different way. So men tend to build relationships more through shoulder-to-shoulder camaraderie, trust. If something's going to go wrong or we're about to die, can I trust you to stand beside me and fight and protect the world, protect our country, protect our children, our families. So building trust looks very, very different for men. But one of the first things we need to do to build trust is make sure that this is not a tick box exercise. We must look at how do we design work that reduces risks to men's health. I've just mentioned two there already. Construction industry, very well known for poor mental health, high levels of substance use, high levels of bullying, not being paid on time. All of these contribute to poor health and well-being for men, and subsequently we see the highest rates of suicide in that industry. Again, I mentioned already logistics. Men who are away from home for long periods of time, don't have access to physical activity, can't eat healthily. So how do we look at designing work that reduces the risks to men's health? This isn't ticking boxes. Having Manbassadors is not going to reduce the risks to men's health if the work and how it's designed is increasing their risk. Promoting positive male role modeling is a very important part of Manbassador. We need positive male role models in the workplace. We need them in education, we need them in the homes, and we start that with making sure that you've got a senior leadership sponsor of men's health initiatives and that it's seen from the top through your Manbassadors to show that this is positive male role modeling. The next one is about developing your managers. So remember how I said the person that the men are most likely to speak to internally is their manager. We therefore need to look at how do we make sure that managers have the knowledge, the skills, the tools, and the confidence to legally protect people through preventing work-related stress, which is a legal requirement, supporting people if they are struggling with a mental health problem through the Equality Act and being more supportive, but also making sure that they are tackling stigma at a cultural level within their teams as well. We've got to ensure buy-in at all levels of the organisation of a commitment to men's health. It's no good just a small team of 10 people trying to do it. This really should be embedded into your wellbeing strategy, and this should be more than just something that we do because it's Men's Health Week or November time. It's got to be consistent. So number 3 is use male-friendly activities. This is a really important part of engaging men. So we want initiatives or activities that specifically target men. So think about how do we target them? What activities might they be interested in, but what's important to them? If any of you remember the Clunk Click Every Trip campaign, which was back from the 70s, I want to say, even if you can't remember the campaign, every time you get in the car, you put your seatbelt on, which was the Clunk Click Every Trip health campaign. And the reason why we're now taking the behaviour from that campaign that happened almost, 50 years ago, is because it was specifically targeted at men and it was targeted about what was important to them. This wasn't about put your seatbelt on to protect yourself. It was about making sure everybody had their seatbelt on. Men were the drivers 99% of the time in those days, but it was about protecting your family, protecting your kids, and protecting your partner or your wife who was sat in the passenger seat. Consider using shoulder-to-shoulder activities that we've talked about there. Many men love goal-orientated activities. They love to have a purpose. Like, what's the whole point in this? What's the purpose of this? Challenges, competitions, bit of friendly competition, always really good at engaging men. But what these do is they help to build trust, it helps to build connection, and that encourages natural conversations. Asking men to come along, sit in a group of people and just talk about their feelings doesn't often work. So what we have to do is to encourage those natural conversations. Next one is all about using your activities that harness male camaraderie. So again, this is about connection, building trust, and embedding education about men's health into your activities. So once you've got them there, then we can have the conversations. Then we can remind them about the EAP. We can remind them what support occupational health can provide. We can have conversations conversations about, what's going on for you at work at the moment that might be having an impact. What we've also found through the research is that men prefer to access online information and signposting. That's because it's much more private and they can do it in their own time rather than having to walk over to a table and pick up a leaflet that says mental health on it. So again, making it accessible for everybody is a really important part of number 3. So number 2 is all about being welcoming and accessible. So what we found through the research, this one was specifically from the Samaritans, what they found through engaging men was that they like a sense of fun and playfulness rather than the seriousness of come and talk about your emotions. This is about suicide prevention. They like to be engaged with a little bit of fun and playfulness. Take them where your men are. Where are your male workers? We need to reach them on night shift when they're drivers. How do we actually get it to where they are? This is the power of the Manbassadors, because they have little legs and feet and they can walk. And they can go out to the male workers and really get it to the boots where it's needed the most. Communication is a very important part of engaging men. What we found through the research, it's got to be clear, it's got to be practical, it's got to be accessible, and it has to be welcoming. So remember those points when you're looking at communicating with your male workers. Big barrier, can't get a time away from the day job to go. It's really important that if we're going to implement these initiatives that we give them time away from their day-to-day work to engage in these activities, especially when you've put in so much work to organise them. The last thing we want is people saying, well, I can't come because I can't get off the manufacturing line, or I can't get in at that time, or I'm on night shift. So how do we make them accessible? And finally, the number 1 way of engaging men is once you've got them, you've got to keep it going. There's no point just doing this because it's Men's Health Week or Men's Health Month. It has to be sustained engagement. That is key. Yeah. So this is not a tick box initiative. Men's health is important every single day of the year. So think about, how do we keep it going? How do we build that trust and sustain it? It's very important that we regularly evaluate the impact of these initiatives as well, so that we can continuously improve and we can tackle any barriers that might be coming up in our feedback. One of the ways, and this isn't just because we're selling a peer-to-peer long-term program at all, this has actually come out in all of the research, including some of the most recent research from Movember program, that peer-to-peer male support engages men on a more longer-term participation. They build camaraderie, they build trust, they get involved together, and that's a very important part of keeping that engagement going. Regular reminders about resources, about the EAP, Oki Health, other initiatives. It's really important. One of the things that we also found in the research that's very different is women pay attention to everything. So, that'd be good for my dad. My sister would like that. I'll get that for my husband. Usually, many men, not all men, notice how I don't say all men, but many men only really pay attention of, is that for me? Is that for me in this moment right now? So if we're just telling people about the EAP once a year, that's no good. We've got to have those regular reminders, and encourage word of mouth promotion through Men's Health Ambassadors as well. That word of mouth just really shows that this is engaging, people are already there. It shows positive male role modeling and wants your male colleagues to then want to be engaged and active in it as well. So they're the top 5. But what I wanted to do was to show you it in action with an Active Leads case study. And then I'll tell you about the Manbassador challenge. Do hang around for the challenge, because honestly, it is amazing. We have a huge impact. I'll tell you about what happened in the Movember one, but I'll also tell you a little bit about how to get involved. It's free to register your organisation, and it's only £30 per team, and there's lots of benefits I want to tell you about as well. So this is Active Leads. Active Leads got in touch with me around about 2023 and said one of our senior leaders has just died from a heart attack. This was a massive shock to the organisation, to the guys colleagues. They were like, we know it's a little bit late, but what do we do to protect everybody else? So they had a real purpose behind this. And they started off with a pilot of 10 Manbassadors recruited. We implemented the program for them. This is them after their little pickleball session that they had. So why did they take the approach? First of all, they had a high male workforce, so this may be something that you're seeing already. They needed to make real impact. They'd lost a team member, highlighting that need for change. They also knew they needed to challenge assumptions, because in active leads, you would expect that everybody was a fitness fanatic, and that wasn't the case at all. So the active leads team is very diverse with varied roles and functions, and it was really important to engage everybody. And also where they lived. So men's health in Leeds was actually already at crisis. They have higher than average cases of life-limiting conditions, lower engagement with health interventions, and above national average suicide rates. So remember, this isn't just the workplace. When your colleagues go home, they go home into their geographical area, which will determine their health and well-being as well. So active leads, they reflected on it, and they realized that they were a microism of these challenges. They were an ecosystem of all of those challenges that were coming to work every day. And this really made them realize that they needed to target men's health support. So we worked with them to set up the blueprint. So we've built that strong foundation. We've made the improvements around the insight gathering tool. We made sure there was a signposting database. We set up the safeguard and the escalation process, the recruitment process, recruited, trained and onboarded the Manbassador team into the program. They trained 12 mental health advocates, Manbassadors, straight off the bat with diverse backgrounds, and they also developed a digital and print set of information on a specific hub to engage employees as well. It was led by one of their senior leaders as the sponsor, who attended some of the sessions. And then they launched it with quite a big impact. They had some high profile people attending, like Josh Warrington, Jamie Jones and Alistair Brownlee, who were coming along to talk about how it was so important and how much they supported the Manbassador program at Leeds. It was set up for impact. The Manbassadors, they wore their black t-shirts with the Manbassador symbol on it, logo on it. They also had lanyards so that they could use the lanyards while they were active in the role. They were out proactively listening and talking with their male team members. You may be used to mental health first aiders just waiting to come for somebody to speak to them. Well, this is different. Manbassadors are proactive. They're out there. They're making every contact count. They started to engage their male colleagues in engage in activities, but not all of it was physical activity based. They actually even did a pie making day as well. They were breaking the stigma through sharing their lived experiences as well, and started to build this strong support network. So they created a database of partnerships within Leeds for signposting. So they fully engaged in the design and the delivery because it was developed with them. They played a big part in setting it up, in launching it, utilising their skills. And once we started to look at the data, it had a huge impact. So what they decided to do was they made men's health a key pillar of the health and wellbeing strategy. So after 1 year, what the data found was they then realized that they had a bit of an issue around suicide prevention and substance misuse. So they upskilled the Manbassadors further in suicide intervention skills training and gambling and substance use awareness. There were 27 referrals made to further support in the first year and 41 conversations with male colleagues. They saw an improved connection between parts of the organisation that have actually benefited from the Manbassador team. So Active Leeds sits within Leeds City Council, so they started to see an improved connection across the council. They held 5 outreach events across the service for the workforce. They had 15 site visits to engage colleagues and offer support. support, and Leeds Council are now looking to embed Manbassador wider across the organisation. What they also found was that external partnerships became really interested in what they were doing, and they began to create these partnerships to support male colleagues even further. This then led for the Manbassadors to look at supporting with some additional training, some health coaching, using a health coaching model, given access to those that needed one-to-one support, especially to help them to get back into the workplace and shortening long-term sickness absence. So we set Manbassador up, and it grew arms and legs because of the impact that it was making, and went beyond, what we'd initially expected it to do, which was just absolutely amazing. Active Leads are one of the Manbassador teams that joins our active teams challenges twice a year. So I'm really excited about this. This is our Men's Health Week, which is coming up in June, challenge called Million for Manbassador Challenge. Now, let me tell you a story about this. So what happened back in November 2025, for Movember, what we found through the last challenge that we ran, which was called the Take 10 Challenge, workplaces across the UK really did step up for Men's Health Month with that challenge, and the results were unexpected and absolutely extraordinary. Within Men's Health Month, what we did together was we achieved over 11,000 total activities, over 18,000 total miles, and just under 500,000 total active minutes of physical activity. And it was anything. It could be walking, it could be doing squats in the kitchen, it could be dancing, it could have been a gym session. It didn't matter. All that mattered was the activity minutes. So I thought, after we reviewed the Movember challenge, I think we can do better. Let's double that. So I said to Nen over at Active Teams, I think we can hit 1 million together. So that's exactly what we've done. One shared purpose in improving men's health together. We now have a bigger question. Can we aim for 1 million active minutes for Men's Health Week in June? And absolutely we can. So let me tell you about the challenge. So the goal is, together we will look to achieve 1 million minutes of activity for men's health. But there's a couple of things there. It's going to be during the World Cup, so it is over 6 weeks, and teams of 5 colleagues will represent a nation. We've also got Men's Health Week in the middle of that during June time as well. So this is a 6-week challenge with the World Cup and Men's Health Week in the middle of it. So brilliant way to get involved. It's open to all colleagues, so you don't have to just have 5 men. You can have mixed groups. It doesn't matter. What matters is about the challenge. The challenge will be running from the 11th of June until the 19th of July. And as I said, it includes Men's Health Week. And again, all activity counts. It could be short walks, big workouts, dancing in the kitchen, whatever physical activity you do, you just log your minutes and that counts towards your team. So we've got an overall goal of 1 million minutes that we want to achieve together. Your organisation will also be in competition with other organisations, and your competitor may be in the challenge as well. You may be competing against your competitor. And also your teams internally will be in competition with each other as well. I think you should all join this, and also get your senior leaders to set up a team and be in competition with the rest of your teams in the organisation. It works really well. It's only £30 per team to set up, and what will happen is there are prizes for teams and individuals at the end as well. But I just want to share with you some other benefits of taking part. You will boost engagement of your male colleagues and everybody, because this is open to all, but specifically male colleagues, through team-based competition and a shared goal. 1 million for Manbassador and your organisation in competition with others, and their teams in competition with their teams internally as well. Physical activity is evidence-based. Connection is evidence-based. All of these go towards prevention of those 5 biggest killers of working age men: heart disease, prostate cancer, lung cancer, bowel cancer, and suicide. Every participant that joins will receive weekly men's health insights and practical tips from the Manbassador team to share, so that even though they're part of the challenge, they will receive some education around how they can continue looking after their health and well-being beyond the challenge. Also, even if you just sign up one team, you will receive a 10% discount on the Where's Your Head At Mate webinar throughout June. So we've got Men's Health Week in June, but we're offering this throughout the whole of June, not just Men's Health Week. And that's for up to 300 colleagues on one webinar. You get a 10% discount on that. And who doesn't love a prize? Team prizes, individual prizes, and obviously you get to earn serious bragging rights as well, which will be remembered forever. This isn't going to be a Men's Health Week that people will forget by next year. This will be a Men's Health Week that people say, what's the challenge for November? I want to be part of it. I want to be involved. So it's not just a challenge. It is a catalyst for healthier behaviours. We need stronger teams, stronger connection. We need to have those meaningful conversations. We need to educate men and get to them before they reach crisis. So if you want to register your organisation, the link will be sent in the follow-up email, but it's just as simple as activeteams.co.uk/millionminutes. But I will send the link out in the follow-up. I just want to say a huge thank you to everybody that's attended. I've got a couple of questions in the background that I'm going to answer next. But this is the end of the session before I look at the questions. But this is just an important kind of final sentence from me, that when we change the way we engage men in well-being, we don't just improve lives, we save them. And this isn't just about workplaces. This is about the children that our men go home to. It's about the partners, the families, the wives that they go home to. I want my husband to be around longer than ever. I need to annoy him for a very long time, put it that way. So, we've got to make sure that we're doing all of we can, because I'm sure everybody in this room today has a man in their lives that they're just not ready to let go of just yet. Okay, let's have a look for some questions. Will slides be shared after? Yes, Rachel, I'm going to share the slides, any links that I've mentioned today, and also the 5 ways to engage men ebook as well, so you will get all of that information. So another question, could the lack of contact or trust with mental health first aiders be due to a lack of awareness or knowing who they might be? It appears to be fairly new access to support. I mean, that's one of them. So one of the things in our blueprint when we're setting up or helping companies with their mental health first aid programs to evidence return and value on investment is building trust takes time, and we need a blueprint to move people from they're not aware. How do we make them aware? How do we make them want to engage? How do we make sure they can engage? And this service blueprint is based on any organization or any service. If you think about, I don't know, your favorite pair of trainers that might be from Nike, there was a time that you didn't know anything about Nike or Nike, depends how you say it. So every business that is offering a service has touch points in place to build that trust and to get people actually engaged in that service. It takes around 11 touch points to build that trust. So if we've got mental health first aiders and we're not promoting them, they're not being engaged and they're not making every contact count, they're not visible, then that trust is going to be very, very difficult. And people do need a minimum of 11 touch points to get to that point where they're engaging with the service. Another question, we've got mental health first aiders within the business, construction based, but most are women. How best can we encourage more men to become involved in leading the change? So let's have a little think. Most are women, construction based, most are women. How can we best encourage more men to become involved in leading the change? I think starting at the senior leadership team helps. Who is a male colleague in the senior leadership team who can start to have these conversations, gain psychosocial safety across the organisation, as an organisation-wide thing to start off with. Getting them involved in a challenge like this, it's only 30 quid a team. Why don't you task a challenge with you guys in the workplace to go, okay, well, we want to put 5 teams on. Who would like to be 5 team leaders? Who would like to pick the teams? So getting them involved in an easy challenge like this is a really great way to start the conversation around that. Once you find the right people and the right way to engage them, it grows in arms and legs. So I think for me, it's about senior leadership, making sure that they're visible, having conversations, building psychosocial safety from the top, and then use something like the Manbassador challenge to get them involved and get them hooked without saying it's a wellbeing thing or it's about suicide. Actually, this is a World Cup challenge around men's health. Do you want to have a team together? So that could be a little way to do it. Do you have any suggestions about communicating to the male workforce that youth and wellbeing resources at EAP would not go on their employee record? Also health issues, addressing any concerns about job insecurity and or promotion opportunities in relation to physical and mental health concerns they might have. That's a very long question with lots of things that I could sit here and unpack for forever. What I might do is I might save that and I'll do a follow-up in a bit more detail with it that I'll send round. But the thing with communication is we can communicate all day long, but we've got to make sure that that communication is being opened and read by the workforce. So again, how do you make sure your male workers are engaging in the communication? First of all, because you can create the best communication, newsletter, whatever, it could be amazing. But if your male colleagues are not actually opening it, engaging in it, then it's a waste. Have you got a communications team? Is there somebody internally who can help you start to look at this and really start to unpack it? Also think about, how do we change some of the language? Can you look at your demographics? Can you segment your communications and send these communications only to your male workers so that they are a little bit more targeted, using different language? Thinking about, the benefits of the EAP could be not necessarily that it's for them, because men probably really don't care that an EAP is available for them until maybe they actually feel like they want to attend and need it, because they're less likely to use it. But it may be accessible for their family members, their dependents. So think about not necessarily saying that this is for you, but this is how all of these things are going to help you to go home healthier, happier, live longer, be around for your kids and your family longer. You're more likely to get engagement around all of your services by just changing the way that we're targeting it. Another question here, I do want to get through them all. Are you able to share further case studies? Yes, we've got a case study from Nexus. I'm more than happy to share that. I'll pop it in the slide. I'll pop some slides in for you as well. So everything that you've talked about is based on those that work with their colleagues on a daily basis and part of our health and wellbeing work stream, as well as mental health first aid for finance department. However, the biggest issue we face for staff working remotely who may not only be in the office 1 or 2 times a fortnight, any advice on how to approach to deal with this? Absolutely. If the activity is engaging enough, your colleagues will leave their home office and attend. So think about ways to make it fun, make it engage, and make them want and be able to actually do that. But also not all activities have to be face-to-face. Some of these could be little competitions online. I was listening to somebody who had a horse race, and I'm not suggesting that you do this, but there was a horse race and app that you could download, and you pretend you bet on what horse was going to win, and then you press the video and it played. There are so many ways that we can engage people online now. It could even be an Xbox competition. So think about outside of the box ways to engage people more online without it having to be physical activities. If they are in-person activities, think about how can we make it more valuable for those people to leave their work and attend those activities and get involved. It's got to be value-led. If there's no value there, people won't go. If they don't feel like oh, this is really important, I'm going to get something valuable from this, they'll just choose to do the work instead. So how do you add value? If you've got internal marketers, comms, speak to them. Speak to them about how do we market this with value-led, benefits-led? How do we make sure that we think about this isn't just the activity? What are all the benefits that you're going to get from attending this? You've got to sell it to them. Ask your sales team as well. Sales and marketing, those two people should be your best friends as well-being leads, because they really will help you to sell and market your programs to your colleagues. Couple more questions. What time are we on? We've probably got 4 minutes left. How would you recommend engaging men who are within the organisation in roles that aren't actively on site on the day-to-day, such as day drivers? Oh, my heart. So my husband's a HGV driver and he's a tramper. So he goes to work on a Monday and comes back on a Friday. And this is one of the biggest challenges that we see. I was heartbroken for my husband 2 weeks ago. He'd actually done a job at work. He wasn't given any PPE. There was loads of dust flying up in the air. His top that he had over his face didn't do anything. By the Sunday, he was really poorly. He had some kind of chesty thing going on. He wasn't feeling great. He then went to work on the Monday because he only gets SSP if he takes a day off sick. And as we know, the first 3 days don't count. And my husband just said, Emily, unless I am bleeding and about to die, I can't take a day off. I can't afford to. So when we're thinking about, some of these roles as well, we've got to think about how are we helping them to stay well in certain ways like that. But then, one of the things that we are going to do, so do keep out for our newsletter. One of our tutors on the level 5 qualification, she actually did a project on engaging drivers for improved health and well-being. We're going to do a case study around that. So make sure you follow us on Eventbrite. Make sure that you open our newsletters, because we are planning on doing that. It's an important thing to do, and we're going to pull together a case study on how to actually engage drivers, because it's definitely a personal one for me. How would you improve engagement with team members who are on night shifts or are unable to attend events? Take the events to the night shift. You got to get in there. That's the thing. We've got to make it accessible for the night shift, and it's probably easier to bring the event to the night shift during night shift than it is to get night shift to wake up early, come in early, stay a bit later after the shift to do that. So the only way you're going to do it is take it to them. And unfortunately, that may mean that in HR or workplace wellbeing or occupational health, you've got to do a night shift. And they're a killer, unless you particularly like them. Rachel, how do I sign up to the newsletter? I will send this link for you to sign up to the newsletter, but because you've all attended here today, you will be added to the newsletter as one of our people interested in the Manbassador program and the challenges and stuff. So you will be added just because you've registered through our Eventbrite process. And that's all the questions. Brilliant questions. Thank you so much for attending today. I hope you all feel as passionately as I do about improving men's health together. And if you do, do get in touch. I'm more than happy to have a conversation with you more in depth about this and how we can help. Thank you for coming today, and have a great afternoon. I'll hopefully see you all soon.